Hello again, my name is Ernest Minu. Let's settle for the details now. Western region is the new hotspot, mainly secondary Takoradi Metropolis and Takwa. The team from the Ghana Health Service dispatched to these areas, like in the Obuasi situation, will be there to understand what's going on. In the Savannah region, it has recorded its first case, a 31-year-old worker who works in Salaga and lives in Tamale was infected. Enhanced surveillance has revealed that 12 contacts who are being followed up are also under surveillance. Let's hear from the Director General of the Ghana Health Service, Dr. Patrick Abuaji, give us a breakdown of the case count so far.
As at 24th of May 25th, total of 156 new cases have been recorded in Ghana, and this shows the new trend of showing much fewer cases. The cases were identified in 5 out of the 16 regions. Greater Accra contributing about 72 new cases, Western region 57, Central region 13 cases, Volta region reported an increase in 10, and Ashanti recording probably the lowest figure ever of 4 new cases in a day. We will do more about Western region, which is becoming a new hotspot, a phenomenon that we have gotten used to now. So if you go into the full details, you will see that based on all that, the total count, cumulative count in the country is 6,964 cases, out of which 2,097 have recovered, and I'll keep on saying that this is still a tip of the iceberg, because as we ramp up testing of those who have recovered, we get a lot more. There are 15 cases who are severe. I'll give you details of where they are. And as Dr. Akwede said, those who are critical, we don't have anybody who is in the critical position. They don't need any ventilator. We have recorded 32 deaths so far. For the confirmed cases and treatment outcomes, out of the 15 cases that I say are severe, none is on ventilator, so there's nothing, nobody is critical. We have 4 at the UGMC, that's University of Ghana Medical Center. Ghana East has 3, Whole Teaching Hospital has 1, Kolebu Teaching Hospital have 1 in their world, Kumasi 3, Kumasi has Konfanuchi, and Tete Military Hospital has 1. We have about 800 people in isolation across the country. About half of that, or more than half of that, are in Accra, the Pentecost Convention Center, and the rest are in various centers, isolation centers in Ashanti, and some of them are in hotels in the rest of the region being isolated. And we have had about 10 regions have not reported a case. Greater Accra, the details are there. So they have so far recorded about 4,835 cases, accounting for more than 80–85% of all the cases in the country. We have Ashanti recording 1,062, but they have 4 new cases today. Central has a cumulative figure of 306 with 13 new cases, and I'll give you the details of where the districts are coming from, because those are very important to us. Eastern has not reported a case for a while. Upper West, Upper East have also not recovered a case for a while. In fact, most of the cases in Upper East, they've almost all recovered, and so one can probably start seeing them some level of clean sheets. In fact, their treatment center is temporarily closed until they have a new case. Volta has 10 new cases, but they have a OT has 26 cases. They've not had any new cases since then. And then we have Western North has had 2, 1 died, and 1 has recovered. And so they are probably in the same state of currently no case. But the new hotspot is in Western region, who reported about 57 new cases. And these are currently we're going to do, because it looks like one of the new hospitals surgeon is mainly the Takoradi, secondary Takoradi municipality and Metropolis, and then Takwa. So a team will be going there to see how we can quickly assist the region to bring it under control the same way we did in Obuasi. Even though the region has already isolated and identified, self-isolated the people and are doing enhanced contact tracing to create containment.